little bit more on the community which you formed. So you have your volunteers or your workers, they visit the patients and they check whether everything is good with them or not, in case they do not have any food or they do not have any mode of transportation, or even if they just want emotional touch or emotional thing to be shared with your community workers do that. My question is, what if they do not have food? Do you supply food, or you are connected with different other vendors who go ahead and get this charity work together?
I think so. The community health workers are like case managers.
Yeah.
They can't provide all kinds of services because sometimes it's a lack of skill set, or we need to be certified. So when it comes to things like addressing mental health and behavioral health issues, we are primarily a Medi-Cal shop, and we have one payer. So if someone is eligible for Medi-Cal, we'll get them enrolled and we'll get them an appointment. And that's how anything related to health and mental health is taken care of. When it comes to things like food, yes, there are a number of community-based organizations who can offer some support. So we try to get them in touch with that. It's by no means, I think the word volunteer, we are not volunteers. This is a paid service. So they're just another set of employees in our organization. The case management services itself is something that California state recognizes as being an important healthcare service. And so we do get reimbursed for certain type of case management services called enhanced care management, and then community health services. So anytime we engage with a patient, whether it's through a phone call or through, we are having them come to the clinic and assess their needs and draw up a treatment plan or a care plan, all of that is recognized as a billable service. And so we are able to establish. It's really important to do that because that allows us to scale, take something small and then make it big. The format of support is a combination of getting them connected to the right resources.
Do you think this job is very fulfilling? Do you feel satisfied? Do you feel happy about what you do?
I absolutely enjoy. I think, it's been 16 plus years since I've been in healthcare. I started out working on the payer side, and then I moved on to health tech, and now I'm on the provider side. And community care organizations are very special. And I wouldn't know what they did until I started working there. So I feel very grateful. I think the fulfillment comes from the impact that I'm able to see. And also, it's a mission-driven organization. So we all work well with each other. We all care for the greater good. And when it comes to helping someone, it's all hands on deck. No one says, okay, I'm busy or I have to go somewhere. When we have a patient in need and sometimes they don't have a transportation, we try and figure out how to get them the support that they need.
That's a great work. We have been building a lot of innovations from decades in that 20% slab. We have got a lot of automations, a lot of AI implementations are being done just to make sure that that 20% is extraordinary. And also when I go to conferences, there is another version of AI in healthcare versus what is actually happening in the clinic, where there is no room for any faulty pilots because, and also there is budget crunch. And of course, no room or no experimentation mode is there. So tell me how you feel about it. Tell me what are the latest developments you have seen happening or you have seen getting implemented in your current organization?
Yeah, I think when it comes to technology, we are an organization, and I've been grateful to have been the leader that has helped build, I would say, infrastructure capabilities, as well as work with teams that have enabled, easier documentation, better optimization of patient care activities, as well as giving us visibility to our workflows and where we have gaps, whether it's in revenue cycle or some other areas. So what I'm trying to say is that in the horizontal layer, the business doesn't run if you don't have a solid system of record, which is our EHR, and then all the technologies that enable it. But I think when you think about where technology has made some marked impact and improvement, in our case, and I think if you look at the healthcare landscape itself, how do you reduce clinician burnout, right? So as a clinician, I didn't go to medical school to know how to document in the EHR, right?
Exactly.
So if you were to take that seriously, how can we make it easier, better, less stressful for the clinician so that they're able to spend more time talking to the patient and learning about their problems and delivering care? So we implemented an Ambient Scribe capability. It's been more than a year and a half, and we continue to scale it and drive adoption. I think one of the nuances in healthcare is that you can't have big scale launches like you would in other industries.
Makes sense.
Because it has to be extremely systematic, methodical, and at no point can you enable something where you are not 100% sure it's going to work well and deliver the outcome that you're expecting, because the adverse event can be extremely costly, both from a patient care and patient life perspective, or when you look at other things in terms of cost and revenue. So it's really, really, really important that you have well-vetted technologies that are HIPAA compliant, taking care of all things related to a patient's condition, their privacy, as well as that it's really allowing the clinician to do something that they really are intending to do. So we have slowly, we started with a small pilot of early adopters, and a lot of word of mouth, and then constant reinforcement of the benefits of those capabilities is really important, because then it allows us to draw more others to really scale these kinds of technologies, right? So that I think has been one of the biggest areas of improvement. I think aside from that, we are always looking to enhance our infrastructure, whether it's in the way of enabling ease of use or enabling us to have a better visibility of our data. One of the other areas that I've been very fortunate to lead and drive for the organization has been in the area of driving and implementing some solid data infrastructure. We do have access to data that sits within our system of record, but it's extremely opaque. It requires a lot of technical expertise for someone to feel comfortable to pull it out. And so I've been able to sort of unpack that and then build a data warehouse internally, and today we've enabled and built some dashboards that allow folks who have no idea what they're looking for to come out and look at business performance metrics, clinical quality performance metrics, our patient population mix. How does it look by demographics and race, ethnicity, income, age groups, as well as also language preferences, and at the same time also looking at their payer constitution, the payer mix across the board, because it does vary by service line. And I think this has been extremely important because it is allowing us to understand our business better, understand what's working well and where we see some gaps. So instead of taking a wild guess and looking at anecdotal information to drive improvement and changes, we have real data. So we have facts. And we can also prioritize where we want to go first and second and third. And it's easier to get alignment and buy-in when you're operating with facts and data versus when it's only anecdotes and someone's perception and opinion.
Sense. Data can make everybody feel comfortable or show them the reality.
Exactly.
But that is the best way to go ahead with. I'm wondering, how do you do such transformations with limited resources?
Yeah.
What are your best practices?
Yeah, I think it's funny you're asking that. I was thinking about it this morning. I think it's, just being open to change. In a small organization, I'm sure you can relate to it. You wear many hats at any time. I think it's teamwork is dream work. It sounds very cliche, but it is absolutely the secret ingredient. the ability to lean in,
Mm-hmm.
stretch, be curious. I've been very fortunate to be working alongside some extremely talented and creative people
Mm-hmm.
and some exceptional leaders too. So I think at the heart of it, I care about what I'm giving back to the community. And I'm also at a point in my career where I want to pay it forward.
Mm-hmm.
I feel fortunate to have had the opportunity to do many things and experience many areas, whether it's in the domain of healthcare or some other industries. So I feel it's now time to give that back, whether it's sharing knowledge or expertise or mentoring people. So I enjoy that a lot. But yeah, I think staying humble is also extremely important.
Yeah.
Because although it feels like I've been in this industry for a very long time, I still feel like I don't know much. And every day I learn something new
Every
and I
day is a
discover.
new day. It's like,
Yeah.
yeah, but I completely agree with you. If you're not humble, if you're not ready to give back to the community, this industry is not meant for you. These are some of the things you need to deeply have embedded in you. That is what I believe.
Yeah.
What are some of the barriers you see and you think should be overcome in upcoming years?
Yeah, I think healthcare has become a bit of a luxury good or a luxury service, especially here. And so I hope and pray that we can somehow find a way to make it a little more accessible and hence affordable to many. Cost of healthcare is a huge barrier. And so that if costs are going to be as high as they are, it's going to keep sick people away from getting the care that they deserve and need. I think healthcare needs to be accessible to more people than it is today. So whether it's easing up on some of the regulatory pressures and then finding ways where more people can look at this whole industry not as a for-profit industry, I think is probably going to enable us to drive towards that. I think the second thing is the recognition of the fact that there are structural barriers before you can address a person's healthcare. I think is going to be extremely important, and we have to find ways to build systems and capabilities and resources to enable that. Not just from an individual entity perspective, but more from it requires the intervention of many different entities, including the government, public health, private entities, and so it takes a village to make it happen. And so this is something
it is going to take a village to happen, and I'm not sure, maybe a good number of years, because if we see the healthcare industry and the established community centers or any private or public healthcare centers, they are established from decades. And the kind of data they are having, the kind of establishment, the mindset, it needs to slowly move on to another level of giving back more to the community. Given a chance, what would be one thing you would like to change in this FQHC model?
I think there's a lack of awareness of the FQHC model of care and who we serve, and that we keep our doors open to anyone. And so if I had an opportunity to change anything and something, it would be around just driving awareness and also, communicating the kind of model of care that I think if it were to be scaled and made more broader in terms of scope, can really also help in not only driving access, but also that whole affordability. Because like I said, we don't say no to anyone. So that probably is the only thing I can think of. But I think from the bigger perspective of things happening in the industry, we face the same amount of pressures that others are facing in a different way. I think in our case, resources are very skinny and limited. And so I have to always be scrappy and a little more creative in trying to figure out how can I enable something to happen, but with a lot limited number of resources and budget that is available. So every place I think has its nuances, and so do FQHCs.
Given a chance to rebuild US healthcare, where FQHC is the blueprint, what would be the one thing you would make sure getting right?
I think, in a perfect world, I wish I can be doing a lot more. And sometimes I'm constrained and I have to prioritize because I just don't have the resources. So I think more support for FQHCs because, yes, we are a safety net. We are in these rather rural areas, or not so rural areas, sometimes serving underserved populations. But I think the mission and the impact that we deliver is so far reaching that we can be just doing a lot more with a little more support.
So you're saying resource support.
Yeah.
All right, great. Thank you so much, Mallika, for the insightful discussion.
Thank you so much. I appreciate the opportunity and it's been a pleasure.